Preventing and treating pressure ulcers is one of the most expensive and time-consuming areas in healthcare. It is estimated that about 4% of the total NHS budget, that's somewhere between 1.4 and 2.1 billion pounds, is spent each year on pressure area care. Each pressure ulcer could add up to £14,000 in additional costs to care. As nurses and carers, you may not realise the impact these products and services have on your authority's overall budget, but one of the biggest expenses to the NHS is the purchase of unnecessary equipment for pressure care. However, a large majority of pressure ulcers are avoidable with the right products and procedures in place, and when healthcare professionals are aware of what to do to prevent them. Patients in both acute and community settings are sometimes restricted in their movements. They're either confined to their beds, or more often than not, to some sort of seating arrangement, a chair, wheelchair, or recliner. Patients in a seated position face a greater risk of pressure ulcers, as the patient's body weight is concentrated onto the seating area of the body. So the risk of pressure ulcers on the lower back and buttocks is increased, and therefore making the right choice of cushion is an essential consideration for both the patient and healthcare service. The Repose Cushion from Uni-medical is a clinically proven and cost-effective answer to preventing pressure ulcers. It can be used on all patients that are at risk of developing pressure ulcers, including those at very high risk. Not only can it be used to prevent pressure damage, but also to treat existing grade 1 and 2 pressure ulcers. No other pressure care support surface has been shown to be more effective and less expensive. It provides comfort and effective pressure redistribution and is easy to use. First, remove the Repose from the tube. Refit the two tubes together to form a pump. Connect the valve on the pump to the valve on the Repose product. Inflate the Repose until you hear air exhausting from the pump valve. Stop pumping and wait until you can no longer hear air escaping. Cover the valve on the Repose product using the solid end of the valve cap. The cushion is provided with a strap to secure it in position. The product is maintenance-free, but you will need to check periodically that it hasn't become deflated. If required, Repose can be easily washed with soap and water. First, wash down using detergent, rinse with fresh water, and allow to dry. If necessary, it can be decontaminated with a chlorine-based disinfectant. Then, rinse again in clean water and allow to dry. To deflate and store the cushion, firstly, insert the open end of the valve cap into the device valve. Air can now escape. Starting at the end furthest away from the valve, roll up the product to squeeze the air out. Now fold and insert the cushion into the pump and refit the two tubes together and rotate until the two tubes click closed. Once you've finished with the product, it should be returned to the equipment store, where it will be cleaned, disinfected and stored ready for the next patient who needs it. Repose products have a wealth of clinical evidence demonstrating their efficacy and have been used successfully by the NHS for over 15 years on almost 2 million patients. It is light and easy to carry, durable and effective, perfect for acute and community settings. For pressure care, rely on Repose.